Health and Human Services Secretary Robert F. Jr. is sitting down for his first television interview since joining the Trump administration. He spoke to CBS medical correspondent Dr. John LaPook, giving clarity to his stances on the measles vaccine, billions of dollars in proposed cuts, and who should be paying for Americans' health care.
It's one thing to say the measles vaccine is the best way of preventing spread, but it's another thing to then say, and therefore, we suggest that you get the measles vaccine.
We encourage people to get the measles vaccine, but the government should not be mandating those.
Before yesterday, HHS Secretary Robert F. Kennedy Jr. had said the measles vaccine is the most effective way to prevent the virus from spreading, but stopped short of actually recommending it. It's a stark about-face for the long-time vaccine skeptic.
Robert F. Kennedy Jr.
Since his appointment in February, Kennedy has facilitated sweeping cuts for programs and staffers alike.
You propose more than $11 billion in cuts to local and state programs addressing things like infectious disease, mental health, addiction, and childhood vaccination. Did you personally approve those cuts?
No, I'm not familiar with those cuts. We'd have to go.
There's like more than 50 pages of cuts that I actually went through.
The cuts were mainly DEI cuts, which the president
There were
ordered.
a lot, but I'll give you, for example, about $750,000 of a University of Michigan grant into adolescent diabetes was cut. Did you know that?
I didn't know that, and that's something that we'll look at. I'm not familiar with that particular study, but there's a number of studies that were cut that came to our attention and that did not deserve to be cut, and we reinstated them. Our purpose is not to reduce any level of scientific research that's important.
What's the basic level of care every American should receive, and who should pay for it?
When it comes to health care, that's a difficult question because people have a choice about how sick they're going to be, many people. It's a moral question, too, and it's a philosophical question. If you're smoking 3 packs of cigarettes a day, should you expect society to pay when you get sick?
Maybe pay for you to help stop smoking.
Or should we encourage people, should we incentivize people to take care of themselves? And then when they get sick, make sure they're taken care of.
And stay tuned for more from Dr. LaPook's exclusive interview on the CBS Evening News at 6:30.